My name is Dr. Derrick Borecky, and I've moved to the area to start a practice over in Fredericksburg. I am originally from Florida. I was born and raised in the south of Florida. I enjoy fishing and boating, and scuba diving, spearfishing, all the outdoor activities that Florida had to offer. I liked camping. I would go into the Everglades and spend days on end in the Everglades. Now I incorporate that into my family, and we go out and we camp and we go fishing together. It's quite nice to teach my younger sons exactly what it was like to grow up when it wasn't so hectic. I went to school at the University of Florida and decided to move out of Florida when I graduated. I ended up in Boston, Tufts University, where I joined the military to pay for my education as well as to serve my country. And from there, I was deployed multiple places. I did some time in Bosnia where I was deployed on active duty for the combat zone. And I spent almost a year there, maybe 10 months, and saw some amazing things that were going on in that environment. Did learn a lot, and it helped me grow as a person. I think coming back, I'm able to use that in my practice of medicine to help my patients as well. Afterwards, I did a residency in Peterson Medical Center in San Antonio, Texas, where I had my first experience of the Texas hospitality and goodwill. The medical field has been in my family for many years. My uncle was a physician and internist. My aunt was a nurse, and my cousin was a nurse. It's kind of like medicine is in my DNA. My brother's a veterinarian, and during my undergraduate career, I was either dual path towards engineering or medicine, and I found that medicine was the proper fit for me. So therefore, I pursued medicine full core at that point, and this is where I'm at right now. My family is from Kerrville, my extended family. My wife's whole family's from here. She's multi-generational, and my 15-year-old will now be the 4th generation high school student in this town. So it was important for family to move back to a more core value community where I felt that he would be able to be raised in the proper environment. I chose to be a physician in order to be able to follow individuals through time and help them with all their issues and problems. I found that I chose internal medicine because it allowed me to be part of their family and part of their structure of good health. I feel that other subspecialties, although they drew my interest, they were all choppy. So you would follow a patient a short period of time, you would never hear from them again, you didn't know what happened to them. But in internal medicine, you all become part not only of the community, but of everybody's lives. Although in my previous practice, I had wonderful patients and subspecialists, it wasn't a right fit as my family has been growing. I chose to raise them in a smaller environment where they can be part of the community and not just a number. I was looking for multiple areas in the Hill Country to find a proper fit for my family. Kerrville was top on the radar, obviously, because my in-laws live here. But I chose Peterson in particular because of their forward thinking, their innovation, their wanting to combine health and longitudinal satisfaction of the patients in the community. I also found that they are very integrated within the community, and they want to be positive in all aspects of healthcare. I'm extremely excited about opening a clinic in Fredericksburg, and it will be the first Peterson clinic in the area. I think that we can set a standard that will be hard to beat, and I think that patient satisfaction is a primary goal for my mission in that location. I think the Fredericksburg community has a lot of positive aspects that I'm looking forward to experiencing. I would like to share not only my own family and self with my patients, but I can't wait to hear what they have to share with me. My leisure time is spent with family mostly. I have 5 children, all boys. The older ones are out of the house, but I still have a 9-year-old, a 12-year-old, and a 15-year-old that are now full-time. And we're trying to raise them in the best way possible in today's world. So I feel that this Hill Country area is the proper place to raise a family with good moral values. The thing I love most about Peterson Health is their forward-thinking mission of taking care of the whole community along with the patient. And I think that's important because the patient is part of the community and the community is part of the patient. And I think that when a person is treated holistically that way, that their overall health will be better.